and also can affect may change over time and can affect any system within the lung, within the body. Okay, so the system that may involve is ENT. Patient may present with respiratory symptoms, also cardiovascular symptoms, GI symptoms, uh, neurological symptoms, psychological symptoms, MSK symptoms, dermatological symptoms, and patient also may present with generalized symptom only, such as fatigue, fever, and pain. Okay. Mm, this is, as you can see here, this is a picture show the timeline of post-acute COVID-19. And we can see that the acute COVID-19 usually lasts until 4 weeks from the onset of symptoms, and which at this phase, replication competent SARS-CoV-2 has not been isolated. And then we can see beside dia punya acute tu, kita nampak ada post-acute COVID-19 yang defined as persistent symptoms and also ataupun delayed ataupun long-term complication beyond 4 weeks from the onset of symptoms. And usually at this point of time, the PCR will be negative. Okay, and the symptoms as I described previously. Okay, next we move to the data analyzed. This is the data analyzed from our hospital, Hospital Sungai Buloh COVID-19 Rehabilitation Outpatient Specialized Service. It showed that 63.6% experience post-COVID-19 syndrome. And then actually most patients reported with cluster of symptoms. Okay. So how we approach this kind of cases, the keyword to approach this kind of cases is holistic person-centered approach to assess all cases. And as usual, we have to find we have to know the clinical history, examination that involve physical, cognitive, psychological, psychiatric, and also functional abilities of each patient. Okay, and please include this point in the clinical history of suspected or confirmed acute COVID-19 previously. So we have to know either they did the confirmatory test or just a screening test, and then the nature and severity of other health condition and current symptoms. And the last one is timing and duration of symptoms since the start of acute COVID-19. This is the example from the our post-COVID-19 management protocol, first edition 2021. The example of clocking sheet for post-COVID-19 patient, we must include the date of diagnosis, the date of discharge, and then the symptom previously and currently, and then clinical stage previously, and complication, any current medication, any comorbids, and then the examination part, we can see that we have the full vital signs, and then we may include of MMSE or DAS punya score if indicated. And then from here, we can know, we should know the baseline of oxygen saturation for that patient. If previously he or she was diagnosed with COVID-19 and already affected 75% of the lung with organizing pneumonia, so we may accept 88% and above for the oxygen saturation of that patient. Okay. And then while investigation, now we move to the assessment. While investigating the post-COVID-19 syndrome, please ensure symptoms are not attributable to other diagnoses. That the first one. And please be aware that people can have wide-ranging and fluctuating symptoms after acute COVID-19 and can change in nature over time. And we may discuss also how the person's life and activities has been affected by COVID-19, and also discuss the person's experience of their symptoms and ask about any feeling of worry or distress. And in this discussion, we may include the family member or carer, okay, to have a better assessment. And next is investigation. All post-COVID-19 patients must undergo investigations based on clinical indication and availability of tests at health facility. And then before that, we have to establish the red flag symptoms that could indicate the need for emergency assessment for serious complication of COVID-19. What are the red flag symptoms for post-COVID-19? The first one is breathlessness or hypoxia. That's why we have to know the acceptable oxygen saturation for each patient post-COVID, and then any syncopal symptoms, unexplained chest pain, palpitation, arrhythmia, delirium, focal neurological signs, and the last one is multi-system inflammatory syndrome, especially in children. A positive viral test is not required to establish a diagnosis of post-COVID-19 condition. However, RT-PCR may indicate it if suspected of reinfection. And we can proceed with lab testing and special testing if based on our clinical findings and also history, if patient presented to us with post-COVID symptom. Okay. So these are the examples of investigation, lab investigation that we can send. Baseline HBC, electrolyte, renal function test, liver function test, inflammatory markers, and thyroid function test if patient presented with palpitation. And then we can send a D-dimer, fibrinogen, and also to rule out emergency punya case, we may send a cardiac biomarkers. Okay. As I mentioned previously, consideration for target oxygen saturation in post-COVID-19 patients also may differ because some patients may only have a mild to moderate organizing pneumonia, and some patients already have the pulmonary embolism affected their lung, and referral to pulmonologist may require in suspicion of COVID-19 lung damage. So the last one we move to the management of common symptoms for post-COVID-19. If patient presented to us with cough and breathlessness, what we can do? First, we have to optimize management of pre-existing respiratory condition, and then at this case, we should know either that patient already have previously diagnosed with lung conditions such as asthma, and then COPD or any lung disease, and then we can teach them how to do a proper breathing technique, and we may recommend pulmonary rehabilitation for certain patients if required. And then please consider dietitian assistant if symptoms interfere with nutrition. Okay. What we can tell patient about pulmonary rehabilitation. Actually, pulmonary rehabilitation referred to individualized rehabilitation treatment of patient with chronic pulmonary disease after a detailed assessment. So each patient have to do a detailed assessment by the team, by the rehab team, and they can suggest certain exercise or activities that can help to improve the lung function after being affected by COVID-19. Okay. Next, if patient presented to us with fatigue, we can ask them to maximize the self-care, sleep, relaxation, and also nutrition. And then we may recommend exercise with caution, and then we may refer them to physiotherapy or rehab team if needed. And then please take note that if fatigue is causing difficulty with activities of daily living, ADLs, please refer to rehab. Okay. The next one is chest pain. So if patient presented to chest pain, the first thing we have to rule out is emergency condition, acute coronary syndrome, myocarditis, pericarditis, and also arrhythmia. And if patient presented with if patient suggestive of ACS, myocarditis, pericarditis, and arrhythmia, further referral to cardio team may be needed. And then if not, we may manage with reassurance and also education regarding symptoms of concern. And then if patient presented to us with headache, low-grade fever, and myalgia, we have to exclude COVID-19 reinfection. As I mentioned just now, we may redo the RT-PCR and we can see the CT value. And if negative, We may prescribe simple supportive measure and analgesia or antibiotic as needed. And then please rule out other infections such as dengue fever. Okay. Neurocognitive difficulty and also depression or anxiety. This one actually fall under neuropsychiatric complication associated with post-COVID-19. And as we know, this pandemic has been leaving a huge impact on the psychology of mass population. So we can prescribe supportive management if we know how to teach patient. However, if needed, we may refer them to psychiatric team or to primary care for further investigation and follow up. Okay, and then please consider option for supported access to mental health service or online support if patient is unwilling to access face-to-face counselling. Alright. So here we can see the flow chart. This is a management flow chart for walk-in post-COVID patient. This is from post-COVID-19 protocol management first edition 2021. As we can see here, if any patient, post-COVID-19 patient at any category come to us, walk into emergency department or primary care, we have to establish any red flag symptoms. So as I mentioned previously, there are 5 red flag symptoms, and if yes, they're presented with red flag symptoms, we have to stabilize that symptoms first. However, if no red flag symptoms, we may manage accordingly and also can be discharged. And after we stabilize the red flag symptoms, we have to decide either this patient required hospital admission or not. And if yes, she or he required hospital admission, we have to admit for further management. And then the primary team will decide on further follow-up. However, if the patient doesn't require any hospital admission, we can refer to this appendix 1. This one is appendix 1 is flow chart. Show that if that patient doesn't require hospital admission, we can give a TCA until 4 weeks. However, in between of 4 weeks, we may have a teleconsultation for the need of earlier review. This one by usually by primary team lah. And then they may refer to post-COVID. They may review them at post-COVID clinic, and then they may do a further assessment and investigation, including clinical history, examination, and also investigation, like appropriate examination, investigation. And then they will manage accordingly. And if that patient stable to be discharged, they will discharge from their team. Okay. So here you can see at the small box there, the red flags symptoms for post-COVID-19 that we have to take note. All right. I think that's all from me. As conclusion, it is still unknown about how COVID-19 will affect people over time, but research is ongoing. Hence, it is recommended that the health condition of people who have COVID-19 to be closely monitored. That's all from me. Thank you. Any question?
Any question from anyone? Okay, Hanan kan, can you go back to the second last slide if you don't mind? Boleh ke?
Boleh, jap.
Basically the one yang you kata category 4 and 5 post-COVID. Okay, basically if you look at the flow chart, sebenarnya category 4 and 5 tu is sebenarnya daripada you tengok dia buat teleconsultation. So basically yang itu sebenarnya majority is the one who are actually discharged from the ward lah sebenarnya. Once dia dah from the ward, for example example, if the patient reach more than 10 days,
Lama tak boleh lah.
assessment in the clinic lah. But for those yang kita concern is actually those patient, I think majority of the emergency department has started to receive post-COVID patient. And then for those of you on the floor, you notice that it is very, very difficult to refer out the post-COVID patients. So we have decided with ID that our own post-COVID patient or even other hospital post-COVID patient who actually came to emergency department, after being assessed, especially those yang ada those 5 red flag warning sign tu, we can be admitted to our hospital. For your information, at the moment we have 2 wards of post-COVID, basically ward 7B and 7C. And then the need to expand the post-COVID ward depends on the number of patients who actually came to ED or even to the rehab clinic that need to be admitted. So on our part, when the patient actually arrive in our emergency department, first and foremost, if they come with post-COVID, our priority is always to see stable or not, kan? So kalau the stable, of course, you need to see whether the patient is actually acute post-COVID ataupun subacute ataupun dia dah pass more than 1 week. More than 1 month. Okay, so if the patient come more than 1 month usually, and then they came with COVID symptoms, so we might need to consider reinfection, especially when these patients are not being treated with medication. If you can see, those are the patients from, for example, quarantine at home, or even quarantine at PKRC MAEPS, or even quarantine at PKRC private. So they are just being monitored there, and then later after 1 month, they actually came back with more than symptoms like COVID. So we might need to consider reinfection. Or those patients yang discharged from MAEPS, PKRC privates or home quarantine yang more than 10 days. After 10 days, okay lah, post-COVID kan, but then they came with the symptoms of COVID. So please consider, especially lah, they ada strong epic link and then symptoms still COVID, like X-ray is GGO. So these are the patients that majority of the ID will treat as COVID, because sometimes this patient actually came, dia punya duration of symptoms tu dia sendiri pun tak pasti bila. And then some of them are actually asymptomatic. Later baru dia develop the symptoms. So please consider this. But it's very difficult to write this in the pathway. So it's a case-to-case basis. So we can't be very rigid in writing the flowchart, because I'm involved in the coming out with the flowchart as well. So it's a case-to-case basis lah. And I suppose for those who are actually new on the floor, houseman, so kalau you tak sure, you rasa is different from the pathway that is currently ada, so please discuss with the more senior people, and also you can always approach the pakar as well. Okay, so anybody else want to give input, the master student, the other specialists?
Hi, Dr. Sonia here. Just to re-emphasize on Hanan's presentation, this post-COVID, it comes in multi-spectrum presentation. So it is as lame as...
Sonia, sorry, can you on the camera, because some might not know. Siapa yang tanya tu, if possible buka kamera.
Saya dah on dah, bos.
Dah on ya? Alright, okay. Alright, thanks.
Okay, so common physical symptoms like fatigue, dyspnea, chest discomfort, cough. Sounds very simple, and it can last up to 3 months or longer in a post-COVID patient. So first and foremost, that you must understand that even though you may think that this could be a post-COVID, but you must also rule out in your differential diagnosis life-threatening conditions, just like the pathway. So make sure you rule out cardiac issues like MI or pulmonary embolism, yeah, before you jump into conclusion that this is just dyspnea secondary to the organizing pneumonia that the patient had. Okay, always rule out the life-threatening condition first. And according to UpToDate, that these symptoms usually at least 3 months, 3 months or more. So we have to be prepared to receive this kind of patients in our ED these days lah. Yeah, that's all. Thank you.
Anybody else would like to share?
Okay, Lina ada tanya ni kan. Good morning boss. I have question. In which post-COVID patients need to repeat the RTK PCR? If less than 3 months post-COVID, patient has symptoms like COVID, do we need to repeat the RT-PCR? Actually, for us in emergency department, majority of the time you don't really have to repeat because boleh dengar ke? Okay, because majority of the time you don't need to repeat because the decision of treating the patient as COVID or non-COVID, usually kita akan refer to ID kan. The post-COVID patient, we don't have the luxury to admit through BMU. Yeah, so all of these cases, if require admission, basically you need to refer to the primary team, and then you don't need to repeat the PCR to refer to the primary team actually. But if the primary team not sure whether they think it's actually post-COVID ke tak ke, basically they will actually eventually repeat lah. But for us post-COVID symptom, normally we don't need to repeat for the referral because all the admission post-COVID admission will need to be referred. So let the primary team decide. Because bila you repeat pun you want to see, okay lah, majority of the time they will repeat because they want to see the CT value, not whether the patient is positive or not lah, right? Okay, for my suggestions, sebenarnya dia tak ada hard and fast rules. If you think it's the post-COVID, you don't really need to repeat. If you think that is a reinfection, you can always refer to the medical team. But those are the cases they might ask to repeat to see the CT PCR lah, RT-PCR. What about other pakars, your experience? Siapa yang ada ni? Basically Jasmine, siapa lagi? Ashani.
Good morning everyone.
Yeah.
Actually, to say that post-COVID right now, I think those on the floor can see that we are starting to get a lot of post-COVID patients. Most of them that we noted come to us because of respiratory symptoms lah. So there are quite a number of patients that we have gotten that come in with pneumothorax and also pulmonary embolism. So always keep that in mind, but not to forget the other symptoms as well. So when it comes to post-COVID, it's very difficult to say these are the management, like there's a specific management. So in the end of the day, it's, you have to go back to your clinical, ask the history and treat accordingly because post-COVID syndrome, it encompasses the entire, literally from your neurology up to every single organ in your body. And there's still a lot of studies being done. So there's no proper pathway yet to say that, oh, this is how I'm going to treat a post-COVID patient. So any patients that walk into us, post-COVID patients, take their symptoms seriously, try not to disregard them. If you see the vital sign, okay, just don't say that, oh, everything is okay and I want to discharge this patient. Always discuss back with the primary team. And from our side, so far, I don't think we have a problem of admitting post-COVID patients. Most of the time, the primary team will admit them for further investigation. I think that's about it from my side.
Okay, Kok Fong, Bashani, anything to add?
Assalamualaikum, Dr. Su Afifah. Apa ni, I agree with, I think Sonia and Jasmine has emphasized a few times that that I think the conclusion is that post-COVID presentation, if you want to say this is a post-COVID syndrome, it's a diagnosis of exclusion. So you have to make sure you attended to the chief complaint first lah. Okay, so do whatever you do, like the patients are not post-COVID patients. Okay, so you have to look for the differentials, especially the emergency one, like Sonia has mentioned. And then don't forget that if eventually the diagnosis is post-COVID symptom, there are rehab. Don't forget the psychological effect lah. Okay, so we can refer them to rehab eventually for the post-COVID symptoms.